Well, heart disease is the leading cause of death for both men and women. The American Heart Association says less than half of women know that heart disease is their #1 killer. Cardiovascular disease kills more women than all forms of cancer combined. And many women are not aware that their symptoms of a heart attack can be dramatically different from that of a man. So that's why we are lucky enough to have Dr. David Hilden from Hennepin Healthcare live in studio. Thank you so much for coming in.
Great to be here.
You know, when we were talking before the show, you said doctors didn't listen to women on this one for 30 years. Why does that surprise any of us? But they didn't listen and catalog the different symptoms that women have or can have. Tell us about that.
It's true, Esme, that, and maybe not to our credit, but medical research, clinical cares. We haven't studied how health affects women as much. And perhaps we don't listen to women as much. And it is also true that heart disease is the #1 cause of death in women, and they do experience heart attacks differently in many cases.
We have a great graphic to show you that kind of explains this. On the left, we have the man. Signs are sweating, pain in chest, arms, neck, or jaw, shortness of breath, heartburn, or indigestion. For the woman, you've got dizziness, uncomfortable pain between the shoulder blades, shortness of breath, gas-like pain or indigestion, and unexplained fatigue and sleep disturbances. I'm not sure I know any woman that's not fatigued at some point. These are very different and can easily be confused with something else.
They certainly can. If you imagine, what do you think of, or what do most people think of when you think of a heart attack? You think of probably a older, probably white man who's going like this and grabbing his chest, and his arm hurts, and they talk about a pressure sensation in your chest. That is the classic symptom of a heart attack. And it is also true that men and women both get chest pain. That is true. But many times, women don't get that. Many women experience, I got an upset tummy and I'm dizzy and maybe I'm a little nauseated and queasy, or it hurts between my shoulder blades. Those would be different symptoms, and many women, either from the way they've been taught or just because it resembles so many other things, kind of blow it off.
Right, and then they don't go, and of course, because they're busy taking care of everybody else. But it is, these are also symptoms of so many other ailments, and we've got COVID going around, we've got the flu. If a woman experiences the uncomfortable pain between the shoulder blades, strikes me as one that's really out there. If they experience any of these symptoms, what should they do?
I tell all patients, if the symptom is new to you, if it's not something you live with normally, you should pay attention to that. Nobody knows your body as well as you do. So if you're having, wow, I'm having this weird achiness in my neck, and that's new for you, you should have that looked at. If you're queasy and dizzy, and you don't normally wake up queasy and dizzy, you should call 911. You shouldn't just say, well, this is something else, if it's new to you. Now, if you're somebody who routinely has a little queasiness, and maybe it's not new to you, that's a little less concerning. But the message is, if it's new or concerning to you, you should have that checked out, because it could indeed be your heart.
Isn't it always better to have the medical intervention at the earliest possible time?
Very much.
It makes a big difference, doesn't it?
Makes a huge difference. We say time is muscle. Your heart supply, your heart doesn't get its blood from its blood supply from the blood inside the heart. It gets it from your coronary arteries, which sit around your heart like a crown. Hence, they're called coronary.
There you go.
And if those blood vessels are getting blocked, you have minutes to act. Just minutes before you have permanent damage to your heart.
And
so
what
every
kinds of symptoms
counts.
would you be feeling at this point?
Well, in women, it might be this dizziness or this nausea, or it might be the typical chest pain that goes into your left arm and your jaw. So if you're having sudden onset of some weird new symptom in your upper body, your upper belly, maybe your chest, maybe your jaw, you should have that looked at by calling 911. It's better to be wrong. It's better to go and say, hey, that wasn't your heart. Because if you wait, every minute does count. 3 minutes is better than 4. 4 is better than 5. Every minute truly counts.
And that is certainly true for men as well. We don't want to ignore the guys out there too as well. Well, Dr. David Hilden, thank you so much. I do want to let people know about your podcast, Healthy Matters, and where can we find that?
Wherever you get your podcasts, or healthymatters.org.
Okay, well, thank you so much. We will look that up. Thank you. I appreciate it.
Great to be here.